Hi, my name is Owen Atkinson of Dairy Veterinary Consultancy. This is the second video in a short series of 4 looking at milk PAG pregnancy testing. And in this video or this presentation, I will take a short look at the benefits of early pregnancy diagnosis. Now, getting cows back in calf in a timely manner is a fundamental part of good dairy farm management. The economic value of pregnancy testing is actually to find the empty or the open cows as soon as possible after breeding. In other words, although it is nice to know who the pregnant cows are, the ones with the green ticks, the value of pregnancy diagnosis is all about finding those non-pregnant cows rather than the pregnant ones, and as soon as possible. It's worth looking in a little detail at pregnancy in cows, where the losses occur, and therefore how pregnancy diagnosis can be used. So typically for a high yielding dairy cow herd, we think of pregnancy rates being in the region of around about 45%. That is to say that for every 100 cows which are served, 45 of them are diagnosed as pregnant at about 30 to 35 days. And immediately we introduce some factors around the definition. Because, for example, the proportion which are diagnosed as pregnant are going to vary depending on how early that diagnosis is made. And I've said a 45% pregnancy rate would be typical in a high yielding Holstein herd, but that's only when the pregnancy diagnosis is made at around about 30, 35 days after breeding. So if 100 cows are served, why do only 45 of them end up being pregnant 5 weeks later? And let's take a look at what typically happens. Now, of those 100 cows which are served, and assuming the service was on time, using fertile semen, the insemination technique was reasonable, actually around about 90% of them result in a fertilized egg. Of these 90 fertilized eggs, only around 2/3 of them, however, will successfully grow and develop into a pregnancy which securely implants into the mother's uterine lining. In other words, develops a placenta. Now, failure of implantation is where the biggest proportion of losses occurs. And it is thought that actually it's the failure of maternal recognition of pregnancy which results in that. And that is the embryo not producing enough chemical, some of which is PAG, pregnancy-associated glycoprotein, to let mum know that it's there, and then she comes into heat and literally the embryo is flushed away as she comes into heat. Now, implantation is complete by around day 16 to day 17. Once implantation has occurred, the pregnancy is much more secure now. Some embryo death at this stage is inevitable, and by about 35 days after breeding in a high yielding Holstein herd, there will be around about 45 pregnancies from those original 100 serves, which is your 45% pregnancy rate. So we can see that if we're doing a pregnancy diagnosis, if it were possible on day 3, we'd find 90% were in calf. On day 16, so just before implantation occurs, around about 50, it's dropped dramatically, so only 55% now would be in calf. Once implantation has occurred around about day 16 to day 17, the pregnancy is much safer. So when we do the early pregnancy test at around about day 30, that's when we would find that around about 45% are in calf. And that would be the pregnancy rate. Now, looking though at the cows that do have a failure of pregnancy, the ones that don't end up being in calf, let's see what happens to them. So of the ones that are failure of fertilization and those ones that fail to implant, actually the cow will come bulling at her 3-week interval at the normal cycle. And the vast majority of non-pregnant cows should have a heat at this stage. The ones that implant, but for whatever reason, pregnancy fails to establish by day 35 or day 30, the early pregnancy testing date, they will be coming back into heat at an interval which is outside their normal 3-week cycle. And this is the smaller proportion of non-pregnant cows. Now, you might think, well, okay, with good heat detection, we should be detecting the vast majority of empty cows. And that is true in theory. And this graph here shows the inter-service interval. And a farm that has very good heat detection indeed does detect a lot of their negative cows at around about the 3-week mark. But some of those are missed and are detected at the 6-week mark. But even farms with the very best heat detection only detect around about 55, maybe up to 60% of their non-pregnant cows at this stage. This is maybe a more typical graph of a farm that has less rigorous heat detection, and a lot of the inter-service intervals are much later, meaning that we're missing those non-pregnant cows. So some of them are picked up at the 6-week mark, and maybe others go further than that and are not served again because it's not recognized they're not in calf. So herds with even the best heat detection, they benefit from early pregnancy diagnosis to find all of the empty cows as soon as possible so they can be reserved. And herds with very average heat detection benefit even more from that early pregnancy diagnosis. Now, by day 30 or so, the pregnancy is quite assured. Even so, it has been estimated that around about 15% of pregnancies may be lost after day 30. The vast majority of these, so 12 to 13%, will be lost from day 30 to about 11 or 12 weeks, with a further 2 to 3% lost as much more visually obvious abortions after this point. All of these figures, by the way, are very approximate. There is very much variation between herds, and that depends on factors such as disease control, uterine health, and genetics. But it does mean that whatever the pregnancy diagnosis is used, it is useful to do a confirmatory test after around the 11 to 12 week mark. The earlier the pregnancy test is done initially, the more important that confirmatory test is. And that is true, however, whatever method of pregnancy testing is used, whether it be by scanning, by palpation, or by using a chemical means such as the PAG test. Now, clearly, some balance needs to be struck. If we test too soon, a greater proportion of pregnancies will be lost. A confirmatory test would pick this up, but we don't want too many false positives. It might lull us into a false sense of security. On the other hand, if we're doing our pregnancy testing too late, we aren't getting the advantage of finding those non-pregnant cows in order to serve them again. The balance is to some extent farm dependent, and it does depend a little bit on what the heat detection is like on the farm. But for a typical dairy herd, a primary pregnancy test between day 28 and day 35, in other words, at 4 to 5 weeks post-service, gives that good balance. The test must be accurate though. If the test has too many false negatives, in other words, diagnosing the cow as not pregnant when she actually is, then we might inseminate the cows which are pregnant or bring them back into estrus. And obviously that's got detrimental consequences. Conversely, if we have a test that has too many false positives, diagnosing the cow to be pregnant when she isn't, then we lose that advantage of finding the early non-pregnant cows as quickly as possible. There's a little bit of difference here between transrectal ultrasound and chemical PAG testing. Although they perform very similarly in overall accuracy at around about 32 days, both of them being 99% accurate in trials, there are subtle differences. So actually with the transrectal ultrasound test, even in the hands of very skilled and experienced operators, it does run a slightly greater risk of missing pregnancies and giving a false negative result. Meanwhile, the PAG test has a slightly greater chance of giving a false positive, i.e. saying the cow is pregnant when she's not. And the next presentation looks in detail of why that is. Now, whilst it would be a good practice to use a confirmatory test after 11, 12 weeks in any case, whether using ultrasound or the PAG test, where early pregnancy diagnosis is being done, it would actually be more risky to use prostaglandin injections to bring a cow back into estrus when she's been diagnosed as non-pregnant by ultrasound compared to using the PAG test. And that risk is greater when the ultrasound operator is less experienced, or if the scanning is being performed at speed. And it's simply because it is easy to miss those very early pregnancies, or it's relatively easy to miss those very early pregnancies. Nevertheless, don't get too hung up on that, because both methods are reliable. And overall, bearing in mind, for an all year round calving herd, it costs in the region of £4 for every additional day to get a cow back in calf compared to the optimal time. And for block calving herds, seasonal herds not becoming pregnant within the block probably has an even greater economic cost. Then in summary, early pregnancy diagnosis will help improve a farmer's reproductive efficiency. It will help get cows back in calf in a timely manner, and it makes economic sense to do so, whether that be by ultrasound or by using PAG tests. But bear in mind, the earlier you're doing the testing, which I am recommending to go early, a confirmatory test is advised after around about 11 or 12 weeks, whichever method is used. And that is because approximately 15% of pregnancies are lost after day 30 and before full term pregnancy, the majority of those being between day 30 and day 60. So I hope that has been useful to look at the pros and cons of early pregnancy testing and some of the economics behind that. The third presentation, the next presentation in this series of 4, is really getting into the nitty-gritty of how accurate the PAG testing is. So this is for those that want the greater detail, the scientific detail of the efficiency of the PAG test, and again comparing it with ultrasound scanning. Okay, thank you very much.